All right. It looks like it's noon. We have a good amount of people in here, so we're going to get started. People may trickle in as we move along. So good afternoon. You are currently in standard precautions and hand hygiene. I welcome all of you to introduce yourselves in the chat box and add where you're from. Also, if you've not done so, last chance to please fill out that pre-session survey that was emailed to you when you registered for the course. I will have Abby throw that in the chat box one more time if you have not completed this yet. This is needed for a certificate of training. You'll have a few more minutes. All right. So taking a look at our agenda today, we will complete welcome and introductions. Then we'll dive into our content, which includes standard precautions, where we're hoping to understand the importance of standard precautions and their implications in the healthcare setting. Then we will be able to recognize risk in a work setting and then appropriately apply different aspects of standard precautions. Next, we will discuss hand hygiene. And here we're hoping to understand how effective, appropriate, and timely hand hygiene can decrease the spread of infection. At the end of today's session, we will review our key takeaways and lastly go over some announcements, future sessions, end of session feedback, and host our live Q&A. As the session goes on, please use the Q&A box to enter any questions you may have that you want answered at the Q&A at the end of the training. Please reserve the chat box feature, which I see some of you are writing in already, for the attendee interactions and communications with our team. So now that some of our front of the house business is completed, I want to thank you for having me today to lead our refresher training on standard precautions and hand hygiene. Again, my name is Allison Thurber. I'm a nurse at the Rhode Island Department of Health and a training liaison for Project Firstline Rhode Island. Throughout my nursing career, I've worked in a variety of settings: inpatient, outpatient, emergency room, a bunch of specialties, and ultimately public health. And while all of these settings require a different skill set, one of the things that's always been universal is my understanding and application of infection control and prevention strategies. One of the core concepts of infection control and prevention is standard precautions, which again, we're going to talk about today. We're going to dive deeper into what standard precautions are, how we can use it to protect ourselves and our patients. And then we will discuss in more detail a very important aspect of standard precautions and very back to the basics, hand hygiene. What is effective hand hygiene? When do we use it? How do we do it? And why is it so important? The Project Firstline Rhode Island team members are logged into this webinar today with us to help field any questions, along with Dr. Kearney, our medical consultant, who will join us at the end for a Q&A. So Dr. Kearney, please feel free to come on screen and introduce yourself to those that may not be familiar with you already.
Hi, everyone. Welcome to today's session. I'm so excited to see all of you here. Let us know as we go through everything if you have any questions.
Thank you, Dr. Kearney. So all of that said, I'm very happy to be with you today and hope that throughout the presentation, you all take the opportunity to engage, share experiences, and share your knowledge with your colleagues. So let's get started. All right, so standard precautions as promised. So standard precautions are the minimum infection prevention standard for healthcare workers in all healthcare settings. These practices are used to prevent transmission of diseases that can be acquired by contact with blood and body fluids. Think of all the rooms you enter, every patient you encounter, every coworker you interact with as potentially contaminated or infectious. No matter how emergent you feel the situation is or how pressed we are for time, adhering to standard precautions is critical for the safety of everyone involved. Standard precautions is about looking at a situation or a patient, anticipating the risk, and then taking the appropriate safety steps to prevent any harm. Standard precautions are used for, again, all patient care. They're based on a risk assessment and make use of common sense practices and personal protective equipment. This helps protect healthcare providers from infection and prevent the spread of infection from patient to patient. Standard precautions are frequently where healthcare workers can become complacent. We are so busy, so the extra few minutes to wash our hands thoroughly or make our way over to the sharps container can feel like it's not that big of a deal compared to all of our daily tasks. But in the end, it's the things that we do every day that can make a large difference in the control of infection. So standard precautions includes hand hygiene, the use of personal protective equipment like gloves, masks, and eyewear based on anticipated risk, respiratory hygiene and cough etiquette, safe injection practices, cleaning, disinfection, and sterilization, including instruments and devices, laundry handling, and waste management. And next, we're going to break down each of these aspects of standard precautions a little bit deeper. So first, we have hand hygiene. Cleaning your hands with soap and water or alcohol-based hand sanitizer is the very best way to prevent infection. In the healthcare settings, in most circumstances, alcohol-based hand sanitizer is the preferred method of hand hygiene. So I will keep this slide really brief as we are going to review hand hygiene in depth shortly, like we discussed in our initial agenda. So then we have personal protective equipment, also known as PPE. Personal protective equipment like gloves, masks, eyewear, and gowns should be used whenever there is expectation of being exposed to infectious material. For example, goggles are not required when you're doing a wound dressing. However, you assess the risk of the situation and determine that your patient's wound has built up a large oozing hematoma. So you put on goggles, anticipating that there may be some splashes and sprays. Another part of standard precautions includes respiratory hygiene and cough etiquette. So this involves wearing masks when appropriate, like when community transmission of respiratory illnesses like influenza are high. Also when patients have respiratory symptoms. It involves covering a cough or educating a patient about covering a cough, sneezing into your elbow, wiping down known contaminated surfaces, and providing tissues and receptacles for respiratory waste. This also includes providing space for and encouraging staff with symptoms of respiratory infections to distance from others and remain home while ill. I know that sounds a bit foreign, but remain home while ill. So next we have safe injection practices and sharp safety. This is also a part of standard precaution. Studies have shown that as many as 1/3 of all sharps injuries in the hospital setting occur during sharps disposal. Nurses are particularly high at risk as they sustain the greatest number of needle stick injuries. The Center for Disease Control and Prevention, CDC, estimates that 62 to 88% of sharps injuries can be prevented simply by using safer medical devices. Prevention strategies can include not filling the sharps container over the fill line, appropriately discarding of sharps, carefully handling and cleaning sharps, like using the built-in safety mechanisms, not recapping a needle, and carefully handling waste in case it may include sharps. Cleaning and disinfection and sterilization practices are crucial to infection prevention and standard precaution. Environmental surfaces like high-touch items, computers, bedside tables, light switches, writing utensils, doorknobs, med carts, all of that should be cleaned and disinfected. Reusable invasive medical equipment should be sterilized according to the product manufacturer by staff that are specially trained to do so. Laundry handling is also included. It's important to handle contaminated materials and fabrics gently to avoid contamination of air, surfaces, and persons. So just as when you go to leave the beach in the summertime and you need to clean the sand off your blanket, you don't shake out your blanket for all of the sand to go all over the place, all over the beachgoers, covered in their sunscreen, followed by all the shameful looks. You just gently fold it up and tuck it away in your bag. Contaminated fabrics should be bagged or contained as soon as possible. Also, it is important to be sure that clean linens are stored, packaged, and transported in a way that maintains their cleanliness. And then the last aspect of standard precautions is waste management. Waste should be disposed of properly, and if there is waste that is saturated in blood or body fluid, be sure that those items make it to the medical waste bag and do not end up in the traditional trash. All right, so let's pause for a minute. I'd like to take the opportunity to share ideas and hear from each other. So think of a time that you recognize an infection control risk, either to yourself or to others in the workplace, and how standard precautions helped you to reduce that risk. If you feel comfortable, you can share your experience in the chat box. I'll go ahead and give you a minute to think about it and to share. And to find the chat box. Where are we here? Again, think of a time standard precautions helped you reduce a risk in the workplace. All right. We will move along because it doesn't look like we have anything in the chat box yet. However, if you think of anything, feel free to put it in the chat box and share with others. Oh, looks like someone added something. So caring for patients before wearing gloves was built into standard precautions and PPE. Yeah. Anticipating risk prior to going ahead and doing whatever nursing duties you have to do. Absolutely. All right. So we are going to move along to hand hygiene. So hand hygiene is also known as cleaning your hands. Practicing hand hygiene is a simple yet very effective way to prevent infections in the healthcare setting. Hand hygiene, which means cleaning your hands by washing with soap and water or an alcohol-based hand sanitizer, is one of the very best ways to avoid getting sick and to prevent spreading germs to others. So we're going to do a quick true or false question to check some of our existing knowledge. So the statement on the screen, CDC recommends the use of an alcohol-based hand sanitizer as the primary method for hand hygiene in most healthcare situations. You can go ahead and use the chat box if you feel comfortable, but what do you think? Is this a true statement or a false statement? Alcohol-based hand sanitizers are the primary method for hand hygiene in most healthcare situations. True, 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 false, true. We have a little mix. Perfect. Okay. So this answer is true. Most of the time, and again, most of the time in healthcare facilities, it is preferred to use an alcohol-based hand sanitizer over hand washing due to evidence of better compliance when compared to soap and water. Hand rubs are generally less irritating to the hands and are an effective method of cleaning your hands. But there are certain times when hand washing should be used as opposed to an alcohol-based hand sanitizer, and we will go over all those instances next. All right, so here before you are different situations where you would need to clean your hands. We will go through each task to discuss which type of hand hygiene is recommended, either hand washing with soap and water or with an alcohol-based hand sanitizer. So I'm going to open my chat box again, and we will just go through each situation. You can throw it in the chat box if you feel comfortable. Again, no pressure. But our first scenario here, immediately before touching a patient, do you think it's recommended to use alcohol-based hand sanitizer or soap and water? Just general before patient care. What do we think? Sanitizer, ABS, soap and water, sanitize. All right. So immediately before touching a patient, alcohol-based hand sanitizer is recommended. Now, it's not wrong to wash your hands with soap and water, but again, based upon studies, alcohol-based hand sanitizer has a higher compliance rate. So we want to make sure that we're capturing as many hand hygiene opportunities as possible. And we recommend alcohol-based hand sanitizer because we see that that has a higher compliance. But again, it's not wrong to wash your hands with soap and water. How about after glove removal? Sanitizer, soap and water, what do we think? I see lots of sanitizer. All right, and that is correct. We have alcohol-based hand sanitizer. Again, soap and water is not incorrect. These are just like the nursing exams we took. It's not wrong, but it's not the best answer. So, CDC does recommend alcohol-based hand sanitizer when you remove your gloves. When your hands are visibly soiled, alcohol-based hand sanitizer or soap and water? Soap and water, soap and water, soap and water. Here we go. Okay, you're all right. Soap and water. When your hands are visibly soiled, CDC recommends you wash your hands with soap and water. Before you ever disinfect, which is essentially what alcohol-based hand sanitizer is doing, you need to clean your hands. And that's what you're doing with the soap and water. You have to get all that particulate off prior to actually going ahead and doing the disinfection. And the alcohol-based hand sanitizer is kind of like a one-step, versus, it'll clean and disinfect. But your hands, you have to get that visibly soiled material off your hands, and that's only done with soap and water. Before performing an aseptic task or handling invasive medical devices, what do we think here? Soap and water, alcohol-based hand sanitizer. All right. Can we kind of just throw in some big words, aseptic tasks, invasive medical devices, but you can still use alcohol-based hand sanitizer there. After contact with blood, body fluids, or contaminated surfaces. Kind of a tricky one. Your hands aren't technically visibly soiled. You had contact with blood and body fluids or contaminated surfaces. You can use an alcohol-based hand sanitizer. But if your hands are visibly soiled, defer back to soap and water. Before eating. Before eating, we recommend soap and water. Also, after using the restroom, we recommend soap and water. So again, I see some people saying, it might be safer with soap and water just in case. We do that alcohol-based hand sanitizer recommendation, or CDC does that, based on compliance, but it's never wrong to wash your hands with soap and water. All right, after caring for a patient with C. diff, soap and water, alcohol-based hand sanitizer. All right. So these answers are just as I expected. So when you're caring for a patient with C. diff, this may seem like a surprise to some of you, and it's a newer recommendation by CDC. However, soap and water and alcohol-based hand sanitizer have both been found to not be very effective against Clostridioides difficile spores. So the push here is towards adhering to contact precaution and glove wear with C. diff, followed by alcohol-based hand sanitizer to, again, pick up on that compliance aspect. So more importantly, we're looking at glove wear and alcohol-based hand sanitizer for the compliance aspect. The only caveat here would be that if there is an outbreak in a facility, the facility may be recommended to switch over to soap and water. I do see some questions. We will absolutely address them at the end. All right. So alcohol-based hand sanitizer is the answer there. After touching a patient or the patient's immediate environment. Alcohol-based hand sanitizer. And before moving from soiled body site to a clean body site on the same patient. Again, alcohol-based hand sanitizer. Good job. And thank you for all of your participation. So again, in healthcare, it's recommended to use alcohol-based hand sanitizer when to perform hand hygiene, except when hand washing is indicated. And those instances are when your hands are visibly dirty, before eating, after using the restroom, in cases of facility C. diff outbreaks, special circumstances like scrubbing in for surgery, or other considerations, for instance, psychiatric services where the use of alcohol-based hand sanitizer may be contraindicated. All right, so soap and water. Let's go over some details about hand washing. Soap and water removes all harmful bacteria if performed correctly with antibacterial soap in healthcare settings. The CDC recommends when cleaning your hands with soap and water to wet your hands first with water, apply the amount of product recommended by the manufacturer, and to rub your hands together vigorously for at least 15 to 20 seconds. Cover all surfaces of the hands and fingers, and then rinse your hands with water and use a disposable towel to dry your hands. Then use that same towel to turn off the faucet if it is a touch or turn knob. Try and avoid using hot water because that can dry the skin, causing cracks. And then alcohol-based hand sanitizer. Alcohol-based hand sanitizer kills most harmful bacteria when performed correctly. When using alcohol-based hand sanitizer, it is recommended to put the product on your hands and rub hands together. Cover all surfaces until hands feel dry. And then altogether, this should take around 20 seconds. Make sure you're not waving your hands around or wiping them off. It has to dry organically. So again, this is most commonly recommended in healthcare facilities because it has been linked to higher rates of compliance, but we did together just review when hand washing with soap and water is needed instead. So another little true or false question. It is best to use the hottest water tolerable to wash your hands so that the heat can kill the germs. Is this true or is this false? Go ahead and put it in the chat box if you feel comfortable. I see lots of false here, and that is correct. This is false. Frequent use of very hot water can cause skin breakdown and cracking. Friction and technique during hand washing is more important to the process than the water temperature. Awesome. And then last here, we have a list of frequently asked questions that I thought we could review together to make sure we're all on the same page about our hand hygiene FAQs. So, question number 1, is it safe to wear nail polish at work? The answer is yes and no. So hand hygiene has decreased effectiveness in the presence of chipped nails. So freshly applied nail polish does not increase the number of bacteria recovered from the skin, but chipped nail polish may support the growth of organisms on the fingernails. Nail polish is okay, chipped nails are not. Also, I would like to point out that every facility has a specific policy and they can be more strict if they choose to. So make sure that as an employee, you're adhering to your facility's policy. Question number 2, do you need to wash your hands if you wear gloves? Yes, please. Gloves protect you, but they also protect patients and colleagues. Use gloves when indicated and change them in between patients and tasks. Do not wear gloves when they're not required, when risk does not indicate, or during different tasks without cleaning your hands in between and changing your gloves. Glove use is not a substitute for hand hygiene, so make sure you're always cleaning your hands after removing your gloves. Question number 3. Does alcohol-based hand sanitizer contribute to antibiotic resistance? Here, the short answer is no. Alcohol-based hand sanitizers kill germs, including antibiotic-resistant germs. And lastly, where can I find materials and resources for me and my staff? CDC Clean Hands Count campaign provides hand hygiene visuals and educational materials for healthcare worker staff and patients in multiple languages. We have added the link to the Clean Hands campaign to your post-session resources that you'll get after today's webinar. But also I'll have Abby just throw that link in the chat if you want it now. All right, so that concludes our active learning for the session. So let's review our key takeaways together. Standard precautions are used in all healthcare settings for all persons receiving healthcare. Standard precautions involves the anticipation of risk followed by infection control steps to help decrease or alleviate that risk. Hand hygiene is a crucial infection control tool. Cleaning hands by using alcohol-based hand sanitizer is the preferred method in healthcare settings in most situations, right? And then there are certain circumstances where hand washing must be performed, and it is important to know when. Now, as we discussed, we are not offering CNEs for this course. However, we will be offering a certificate of training. So to get your certificate of training, the pre-session survey must be filled out. Then, in order to make sure that you receive your certificate of training for today, continuing ed for dental IPC and continuing ed for EMS professionals, please make sure that you complete the rest of the steps, which include attending the live session, you're here, and then complete the post-session survey. The post-session survey will be emailed to you tomorrow, December 9th. It does close December 15th at midnight, 1 week from today. And then if all that is completed, a certificate of training will be emailed to you December 18th. Reminder again, we're not offering CNEs. All right. If you did not enter your email earlier in the chat, please feel free to enter it now to be added to our distribution list of upcoming training. You can also email Project Firstline directly if you have any questions. You can also click on our live events link through our website. Abby will post that into the chat box as well. And then lastly, you can follow Project Firstline on social media. We have lots of it. YouTube, X, Facebook, Instagram, and LinkedIn. On all of our platforms, you can request trainings or materials, ask questions, and see any upcoming trainings that we are offering. This is the very last training of the year, and we'll take a little bit of a hiatus at the end of the year. As we know, the holidays and New Year are a busy time for everyone. So the Measles Microlearn will be our first webinar in the new year. And I can't believe we're saying this, but that'll be January 26th, 2026 from 12 to about 12:15, 12:20 p.m. This will be presented by myself. I'm excited to present this content, especially as so many questions and changes arise from vaccine preventable diseases, and travel during the holidays is heightened, so it feels very timely. Microlearns, just as a quick aside, can be used as a general quick training, but they also can be used as a train the trainer resource. So sign up, come prepared for a quick little touch base with us in the new year. These are our references for today's session. And then if you could, I would invite you to take the 3-question poll on your screen. This helps us improve future sessions and assess your community learning needs. And then please make sure if you have any questions, you put those in the Q&A box, because we are going to hop along to our live quick Q&A right after this. And I have not had a chance to look at the Q&A box, but Dr. Kearney, do we have anything happening in there?
I think the only question I saw come through so far was regarding just clarification of the Rhode Island Department of Health guidelines on C. diff hand hygiene recommendations. And so we'll have to reach out to some individuals at RIDO to get further clarification on that.
Okay, perfect. So we'll get that to you, and then we will email you. So keep in touch. If we don't have your email already, please put that in the chat box if you do have any questions or anything that we need to follow up with you about. And I thank you all for joining us and hope that you have a great day, and we will see you again in the new year. Take care.